Giving brain lesions to non-human animals is often an important step in behavioral neuroscience experiments. It allows us to observe the animal's behavior with and without damage. For instance, you're about to see footage in which we surgically lesion the ventral hippocampus, which is the lower half of the hippocampus, in a long Evans rat. The hippocampus plays an integral role in memory, and damage to it causes amnesia. So we can use lesions to conduct experiments to determine the specific role of the ventral hippocampus in learning and memory. The lesions, or tissue damage, will be induced by injecting a neurotoxin called N-methyldiaspartic acid, or NMDA, into several locations in the ventral hippocampus. NMDA is a neurotransmitter, which at high concentrations results in apoptosis and necrosis, or cell death. And just to note, while the video will show a lesion surgery of the ventral hippocampus, the same techniques can be used to lesion any part of the brain. Rats are transported from their home cage in the vivarium to the surgical anteroom, then placed in this chamber and put under gas anesthesia using isoflurane. Once anesthetized, they're weighed, the head is shaved and cleaned, and the rat is given an injection of analgesic. After this, the rat is placed in the stereotactic frame, which allows us to maintain the anesthesia by delivering isoflurane, and it keeps their head level and immobile during surgery. Once the head is secure and level, we use a scalpel to make an incision after confirming that the rat is fully under anesthesia. It is important to note that everything in these steps is done under strict aseptic conditions, and although the rat's eyes are open, it is 100% anesthetized. We apply tear gel to the rat's eyes to keep them hydrated throughout the surgery. On the skull of the rat, there are sutures where the skull plaques fuse together. The point at the top, towards the rat's nose, where these sutures cross, is called bregma. Bregma is used as a landmark during stereotactic brain surgery. Using bregma, we can calculate exactly where to drill so that the tiny holes are drilled right above the hippocampus. The stereotactic arms allow us to be precise to within 1/10 of a millimeter. For a complete hippocampal lesion, we inject the NMDA into 7 sites in each hemisphere. Even though we only drilled 6 holes in each hemisphere, one of the holes gets 2 injections at different depths. The incision is stitched shut with suture, and the rat is placed in a recovery cage in the anteroom where it will be observed closely. Neurotoxic lesions can cause seizure activity immediately following surgery, so rats are assessed for seizure activity and can be given different compounds to help, such as diazepam or gabapentin. After a few hours in the recovery cage, the rat can be safely returned to its home cage. It will receive post-op care for a week after surgery, with daily assessments of its well-being that include a dose of oral analgesic and anti-inflammatory medication.